Hello 6th semester students. In the last video we have discussed about the history of the sulfonamides, chemistry of the sulfonamides, structure activity relationship of the sulfonamides, chemical classification of the sulfonamides, pharmacological classification of the sulfonamides, and some details of the sulfonamides derivatives. Now we will discuss about the folate reductase inhibitors. First of all, we will discuss about the mechanism of action of the folate reductase inhibitors or general mechanism of action of the sulfonamide. We can see that the PABA is converted into the folic acid. When PABA is converted into the folic acid in the presence of the folic acid synthetase enzyme, then the microorganism development produced. If the sulfonamides inhibit the enzyme of the folic acid synthetase, then PABA is not converted into the folic acid, then stop the development of the microorganisms. So, this is the main mechanism of action of the sulfonamides. Now we will take the example of the folate reductase inhibitors. First example is a trimethoprim, and this is the general structure is given in the picture, that is the trimethoprim. Then synthesis of the trimethoprim, when 3,4,5 trimethoxybenzaldehyde is given with the beta methoxypropionitrile in the presence of the methanol, then it is converted into the cinnamon nitrile. Then again in the presence of the methanol and the sodium, it is converted into the 3,4,5 trimethoxy 2-cyanodihydrocinnamaldehyde dimethyl acetate. Then again in the presence of the methanol and guanidine, then it is converted into the trimethoprim. This is the synthesis of the trimethoprim. Then uses of the trimethoprim, first of all, it is used in the treatment of the respiratory tract infection, GIT, gastrointestinal tract infection, UTI, urinary tract infection. When the trimethoprim is given with the combination of the dapsone, then it is used as a anti-pneumonian drug. Now we will discuss the cotrimazole. It is also the example of the folate reductase inhibitors. Cotrimazole is the combination of the trimethoprim plus sulfamethoxazole. These are the structures of the trimethoprim and sulfamethoxazole. Then uses of the cotrimazole, effective for the chronic bronchitis, and it is also useful for the UTI, urinary tract infection. It is also used as an anti-malarial. It is also used in the Shigella infection. Shigella infection means intestinal disease. So these are the uses of the cotrimazole. Now we will discuss about the sulfones as per US syllabus. It is given in the sulfonamide chapter. Sulfones is the anti-leprotic drugs, and the dapsone is the examples of the sulfones. The structure is given below. Now we will discuss about the structure activity relationship of the dapsone. There is a 3-part. In the first part, para-aminophenyl sulfonyl, this is the first group is must for the antibacterial activity. Second phenyl group, there is 2 phenyl group. Second phenyl ring is replaced with the heterocyclic ring, so it does not enhance the activity. Benzene ring should be small and should be at the para position. So para-aminophenyl sulfonyl group is necessary for the antibacterial activity. Dapsones are divided in 3 parts. First is the hydrocarbon group, sulfur dioxide and hydrocarbon. Hydrocarbon groups are necessary for the activity, and sulfur dioxide group also necessary for the antibacterial activity. Mechanism of action of the dapsone, same mechanism of action of sulfonamides used, sulfonamides same as the sulfonamides, then use of the dapsone. Dapsone is used main in the leprosy. Second, it is used into dermatitis. Dermatitis means inflammation of the skin. Third, pneumonia in the AIDS patient. When the dapsone is given with the combination of the pyrimethamine, then it is used as an anti-malarial drug. Thank you, students.